My name is Hannah Lee. I'm a transplant hepatologist at the Stravitz-Sanyal Institute for Liver Disease and Metabolic Health. If I can just quickly share a story, when I was a second year med student going through rotations, the first patient we saw was a patient with cirrhosis and ascites. And I walked in there, I said, I am not going into GI liver. Well, fast forward, I'm in residency in Boston, and I'm exposed to some excellent hepatologists who made me very excited about liver disease. Liver has a lot of important functions, and so the rest is history. Health literacy is a foundation for strong patient-centered care and a strong determinant to outcomes for health. Unfortunately, some people still think of health literacy as the traditional, do you know how to read, write, and do math? Actually, that is not the true definition of health literacy. Health literacy is a multidimensional concept. It's complex, it's heterogeneous. And actually, the definition for that is for a person to be able to access, understand, appraise, and apply health information to be able to manage their own health and well-being. My passion for health literacy it started with me and my mentor, Chief Dr. Sanyal, talking about what are the gaps and needs in liver disease. My philosophy in my practice is provide the highest quality of patient-centered care. And that means looking at the patient as a whole. And so we were talking about what are areas that are that are a gap in liver disease that is important in the care of liver disease. And he brought up health literacy. There's not much known about it, especially in liver disease. And so I dived right into it and I never looked back. For me to learn about health literacy as much as I can, and especially in the context of chronic liver disease, I need mentorship from world leaders in health literacy. And so I had the wonderful opportunity of attending a masterclass held by Professor Richard Osborne and his team. They're based in Australia, in Melbourne, and he is a global leader in health equity, and he and his team developed this health literacy assessment tool that is used all over around the world that captures the multi-dimension of what health literacy is about. It's used by the WHO. They're working with the European Union, and he's been like a mentor to me because we're delving into health literacy in the context of chronic liver disease, liver cancer, cirrhosis. We need to learn more about the limitations of our patients and their strengths in the context of health literacy and what we can do to create interventions to help them in their care with this chronic disease, this life-threatening disease, this complex care need area. To do all these health literacy assessments, that's just part one. Part two is understanding the needs and creating interventions, because we want to create interventions that are impactful, sustainable, and that will improve the outcomes of our patients. But for us to do that, we're not here to wait for the patients to come to us. We need to go out into their communities, and especially the communities that are very vulnerable and that are socioeconomically disadvantaged, the patients that are being left behind, that are missing out. And so what's exciting about my research is we want to understand the issues, the lay of the land, so to speak, the limitations, the strengths from these assessment tools. And then we want to go into their local communities and engage with them, engage with the local stakeholders, the local leadership. We want to get a sense of what their life is like, what they're thinking, and what are the interventions that we can do that are realistic for them and helpful for them. You can't do a cookie cutter type of intervention for every community. Every community is different. And we're excited about this health literacy questionnaire that Dr. Osborne and his team developed, because this type of assessment tool allows us to do that, to work in collaboration with the local community, co-design fit for purpose, understand the local wisdom of the leaders of that community, and together design an intervention to help them have better outcomes in management of their care. In the context for me, liver disease, cirrhosis, all of it. So I am excited to have a grant to be able to formally study this, and I'm doing it in my liver cancer clinic. And so we are enrolling patients and having our liver cancer patients take this assessment drill. And then we're going to do some analysis and really look at, we want to show that health literacy is such an important predictor of the outcomes. And so, because there's nothing to show that. We want to show that patients with limited health literacy, they come to us later in their disease. They have a disadvantage. By the time they come to us, it's late stage. We want to show that with limited health literacy, there's an increased use of the emergency room and hospitalizations, that they're struggling to follow the recommendations of the doctor. There's many different variables in this. We want to show that health literacy matters. And it is, I should add, a global and national priority because they know addressing this will be important in terms of helping patients address their health and be able to manage their chronic medical condition and the complex care needs they have.